Marcia Johnson, the younger sister.
Sharon Jones, her sister.
And they share more than genes. They also share doctor visits. They're participating in what is called a shared medical appointment with 6 other women who are concerned about their heart health.
I ended up having to have surgery. I had 2 stents and 1 balloon procedure.
More women than men have died from heart disease every year since 1984.
This is part of the reason why Dr. Amy Tucker, cardiologist at the University of Virginia Health System, began offering shared medical appointments. The reasons why these women are here are as diverse as their group.
So at a routine doctor visit where I get my blood pressure medication, it's like, okay, let's check the cholesterol. So I was quite surprised to find that it was much more elevated than I was expecting. So then it was like, where can I get more information about this? What can I do to lower it? Where can I learn about risk factors? So this was the perfect place for that.
Treating lifestyle, empowering women to develop heart-healthy habits around nutrition and exercise and chronic disease management such as diabetes and weight loss, that is a much different process.
It's a process that requires a different kind of approach. These 90-minute appointments include a check on vital signs as well as visits with doctors, nurses, nurse practitioners, dietitians, and even an exercise physiologist.
There's a provider, which in our case is either a physician or nurse practitioner. There's a facilitator in the group who tends to keep the group functioning, welcome everyone, make them feel comfortable, and keep the appointment moving along, if you will, taking into account special needs of the participants. There'll be a documenter who is keeping track of the data coming forward and the physical exam, the vital signs, and so on, creating essentially a chart note by the end of the visit. Then we have a medical assistant type role involved in taking vital signs, reconciling medications, printing prescriptions, other clinical assessment type things. So those are the 4 roles that are a part of any shared medical appointment.
And Hedelt, a nurse practitioner with cardiovascular expertise, believes that the participants benefit from listening to each other and sharing their stories, in addition to receiving excellent cardiac care. Sharon and Marcia agree.
It has worked miracles for me. It has changed my whole way of living. Coming here every month, sitting around with and discussing our health and other issues with the other ladies has been so inspiring to me. Just seeing that there are other women who are going through the same things that I have been going through, and me feeling like, you know, because I'm so young and all these things are happening to me. And even though I am the youngest in the group, I take a lot of this back home with me that we discuss in the meetings. It has just been so uplifting to come here. I enjoy coming here. I look forward to coming to these meetings because we're always going to leave here with something that we didn't know before we came in. So it's been very, very uplifting for me.
Knowing that I have to come every month and that our information is shared, so I try hard to do what I need to do so that my information will be quote-unquote glowing and not one of the ones on the bad side. So it's a motivating factor to continue from month to month to do what I need to do. I had seen, particularly Marcia, try over and over to make changes but not be successful. And some of the things that helped her ultimately were making smaller goals that were attainable and trackable. And I think the biggest thing is that she needed a community of support. So finding an accountability partner, and in her case, her sister, really made a huge difference for her. Someone who embraces the changes you're making, who does them with you, and who helps you on the days that your motivation flags. And sometimes makes it fun.
And I came and I just really enjoyed it. I just found it to be a very fabulous experience. It was very inspirational to hear how other women, obstacles they've overcome, or the things that have happened in their life that they're willing to share. It's very motivational for me to think, okay, I'd like to do something about this. And it kind of makes me feel empowered as a woman that I can take charge. I can do something to make a positive difference in my life. And it's so nice to have the group here because you can support each other, the encouragement for each other is there, and it's so much easier to do that in a group as far as, you know, just to set this out on yourself seems overwhelming. Oh gosh, I can't do anything, it's too much, it's too hard. But when you're sharing that experience with a group of people, it just seems a whole lot easier.
I'm Abina Foreman reporting.